All right, now shifting focus, the World Health Organization says Democratic Republic of Congo's Ebola outbreak is still spreading largely undetected. According to a senior WHO official, 4 out of every 5 new Ebola cases in parts of the DRC, they have no known links to existing patients. Well, the figures underscore the challenges which are facing the health workers as they continue to battle the contain of the outbreak in the country's northeast. The Bundibugyo strain has so far infected 1,792 people and has killed 625 as per the latest government data.
It's like in Bunia, where the intensity of transmission is really very high still. To be honest, most of the cases come from outside of any known contact list. So we're talking about 80%, 70 to 80% of new cases today still coming from outside of contact lists in the Bunia area. And this is really where most of our cases are coming from. 90% of all cases in this current outbreak are reported out of the Ituri province. Basically Bunia, Rampara, Mongalu, Yakunde are probably the most affected health zones.
The WHO officials warned that the true scale of the outbreak could be 2 to 4 times larger than official data suggests. And this is based on modeling and test positivity rates. In Bunia, Ituri's capital, in a city of 1 million, roughly 1 in 2 patients tested for Ebola turns out to be positive. He said it is a sign of intense, ongoing community transmission. He added that authorities this week began training 21,000 community health workers. They will conduct house-to-house visits, identify suspected cases, and encourage people with symptoms to seek care. Meanwhile, UNICEF says that humanitarian situation is at risk in DR Congo. Childbirths recorded at health centers have declined significantly.
Per month before the epidemic, there were around 130 births. Today, we're looking at about 30 births per month that are actually recorded in maternity wards. Where are the other 100 births taking place? It's clear they're happening outside health centers, which means there is a crisis of trust between the population, the community, and the health centers. There is a crisis of trust between communities and basic social services in general.
UNICEF stressed that any investment in Ebola must also bear in mind the need to go beyond the emergency response, and this such that the system is sufficiently strengthened to eventually deal with future epidemics. It added that continuity of health services as well as other basic social services, they must be ensured alongside stepping up Ebola response. Meanwhile, elsewhere in the region, MSF is training health workers to strengthen them to be able to respond safely and effectively to the Ebola outbreak. Nettoyage légal hygiénique pour la mission. C'est ce qu'il fait.